Let's talk about perfusion. I want you to think of perfusion as a concept that represents mechanisms that facilitate perfusion of oxygenated blood throughout the body. Blood flow supplies oxygen and nutrients continuously to tissues so they can perform their function. These tissues include skin, kidneys to produce urine, brain for intracranial regulation, gastrointestinal tract for metabolism, and muscles and nerves for motion. Interruption in perfusion will result in pain. Once again, understanding of these interrelationships between concepts will help you recognize risk factors and increase your awareness when conducting a health assessment. When you interview a patient, collect subjective data about patients' present health status, past health history, family history, personal history, and psychosocial history, because it may affect the functions of their heart and peripheral vascular system. When reading problem-based history questions from your textbook, please pay attention to rationales given under those questions because it explains why of those questions. For example, if a patient complains about chest pain, why do we need to ask what makes the pain worse? It's because the chest pain from pericarditis is aggravated by deep breathing, coughing, or lying supine. Supine would be when they're laying on their back. Chest pain from muscle strain, on the other hand, may be aggravated by movement of arms. Your textbook has a beautiful table that gives differentiation of chest pain. Please read over that. As you conduct a health history related to cardiovascular system, you ask the patient about common risk factors associated with hypertension. Some risk factors are related to family history, age, gender, race, lack of physical activity, poor diet, being overweight, alcohol usage, tobacco smoking, and so on. Your textbook has a risk factors box in Chapter 12. Please make sure to read over that too. When we palpate the heart rate, you will be using finger pads of the first two fingers and applying light pressure. If you press too hard, you obscure the pulse. Note the rate, rhythm, amplitude, and contour of each pulse. Comparing pulses on each side of the body is customary. When you are unable to palpate a pulse, use a Doppler to amplify the sounds of the pulse. If you find or note edema on a patient, pay attention if it is on one side or is it on both sides. So if it's on one side, it will be called unilateral, or if it's found on both sides, it will be bilateral. And you also want to make sure if the consistency is soft, firm, or hard, or if there is any tenderness. The technique for testing for pitting edema is you will press down on the area where you find edema, and then indentation will remain where the fingers were placed. Then it's termed pitting edema. So it's an indication of excess fluid in the interstitial space. If edema is barely perceptible when you lift your fingers up, it will be noted as 1+. If it's a deeper pit and rebounds in a few seconds, it will be noted as 2+. Rebounds in 10 to 20 seconds and deep pit, it will be 3+. And if it rebounds in more than 30 seconds, it will be even more deeper pit. It will be noted as 4+. When the heart sounds are described as lub-dub, the lub represents S1. That's the first heart sound, which is made by the closing of the mitral and tricuspid valves. S1 indicates the beginning of systole. The second heart sound, S2, is made by the closing of the aortic and pulmonic valves. It is known as dub of lub-dub, and this indicates the beginning of diastole. Count the number of heartbeats, or we can call them S1, S2 here. Count the number of heartbeats heard for 1 minute for the apical rate. When listening to each heartbeat, notice the spacing between the beats. Normally, the heart rate is regular, meaning an equal space between beats. And if there is A deficit or difference between apical rate and peripheral pulse rate is known as pulse deficit. This is determined by auscultating the apical pulse and palpating the radial pulse rates simultaneously. The apical and radial pulse rates should be equal. The apical rate may be faster than the radial rate when the patient has cardiac dysrhythmias.